Tonight in Medical Rounds, with warmer weather here, now is a good time to think about protecting yourself from the sun's ultraviolet rays. Dr. Omar Eaton, Medical Director of the Hartford Healthcare Cancer Institute Melanoma and Skin Center, joins us now live to talk more about melanoma and about an important event that you won't want to miss. Good evening, Dr. Eaton. Nice to have you here tonight.
Good evening. Thank you for inviting me.
Well, we know that we can all be proactive when it comes to our bodies and checking for suspicious moles or spots. What should we be looking for?
Well, early detection is the key to cure. So everyone should know their ABCs of skin cancer detection. Those are A for asymmetry, B for border irregularity, C for color. Things could be brown, blue, black, red, or even with no color. And D is diameter. Anything larger than a pencil eraser head should be of concern. And E is probably the most important. Anything that's changing, growing, itching, or, God forbid, it's bleeding.
Okay, good to keep in mind. And shouldn't we also, Dr. Eaton, be checking areas of the body that rarely see the sun?
Yes, it turns out melanoma can appear anywhere, front or back, and also in unusual locations such as in the scalp, in the nose, under nail beds, on the palms and on the soles of the feet, also in the genital areas, and where the sun never shines, also the intestine.
The intestine? Oh, my goodness.
Yep. Inside the intestine. Yeah.
So, but what is the best level of protection and sunscreen? You see so many choices when you go to the drugstore. SPF 30, 50, 70. What do you recommend?
Well, primarily, just wearing loose-fitting clothing and a broad-brimmed hat is my position if you're out there for not a long period of time. During the summer, when especially children are out on the beach, it's a good idea to use sunscreen, and we would not really go beyond SPF 15 or 30. And this has to be reapplied usually every 2 hours on the beach. But the most important rule of all is to try to avoid spending too much out in the sun between 10 a.m. and 3 p.m., where there's the highest UV exposure.
Okay, good to keep in mind.
One last point is tanning booths. Avoid tanning booths.
Yes, all right. We have a few seconds left, and I have to mention that we're so pleased to be partnering with Hartford Healthcare again to raise awareness about skin cancer. It's an event sponsored by Access Health, and will be held at West Farms Mall, and you, I understand, and other doctors will be there?
Yes, we're going to have a grand event this year. We had a very successful one last year. We are bringing 3 dermatologists, 2 surgical oncologists, a retinal specialist, because melanoma can occur in the eye, and myself, a medical oncologist, will present more about all of this, and also will examine patients, their easily accessible lesions that they're concerned about, and present a plan to them.
Boy, that sounds like a great opportunity. Thank you so much, Dr. Eaton, for sharing this life-saving information. I bet you'll save some lives on that day. And when is it, you want to know?
I agree.
The Hartford Healthcare 3 Cares event, sponsored by Access Health, will be held on Wednesday, June 6th at West Farms Mall at the Hartford Healthcare Rest and Relaxation Lounge there. It starts with the Walk to Wellness from 9 to 10 a.m., followed by a Learn Your ABCs Around Skin Cancer from 10 a.m. to 2 p.m. For more information, just call the number you see on the screen. In the meantime, you can ask Dr. Eaton a question on the Hartford Hospital Facebook page during a live discussion beginning at 6 p.m.